Hey guys, and welcome to RNscrub. Today we're going to show you how to set up for an admission. Now you want to make sure you gather all the information you can get for your patient so that you can appropriately set up for that one patient. Now double check your protocols also to set up the bed accordingly. So here we have a flat sheet, we have the SCDs, a gown, the SCD machine which is on the bed per our protocol. There's a chuck, a fitted sheet, and then there's also a pillow with a pillowcase. And then you want to go ahead and zero the bed. This is very important, especially for, you guessed it, the cardiac and renal patients, especially if they're on dialysis. Once it's zeroed, you can erase the history and then just double check the parameters of the bed, make sure that there's no trash around. And as we go over here, you want to make sure that the call light works, toss that over there, and then that the suction canisters are set up. So here's suction tubing, a yank out, the canister, and then you also want to stop and make sure that these canisters are actually hooked up and that the suction works. The last thing that you want to happen is you're trying to suction a patient and they're choking on something and you can't do it because you didn't double check if it worked. And so you also do the same thing with oxygen. Make sure there's a Christmas tree there and that the oxygen works. You can also gather yourself a simple face mask, an oxy mask, or nasal cannula depending on the patient. Of course, you want to call your RT if they're on a ventilator. And up over here we have the probes. So you have your oximeter probe, your blood pressure probe, and then your EKG connector. Depending on your patients, if they have like a CO2 that they need to monitor, a CVP or outline, set up for those things too. And then check your monitor to make sure that it works too. All right, and setting up for the patient, you have your oxygen sensor, you have your electrodes, and then also your EKG wires. And then depending on your protocol for the ICU, we have to swab them for MRSA. So there's a nose and throat one, and then we have to wipe them down with CHG wipes. It's better anyway to double check your patient. You want to wipe down your patient and check their skin, and then to prevent any skin breakdown on the bottom, place some Mepilex on them. Check to make sure that your computer works, and then your IV pumps. And that's pretty much it for setting up the room, guys. And let us know what you think. Go ahead and comment down below. Go ahead and subscribe too. Thanks so much for watching.